Hello, everyone. My name is Rob Moss. I'm a Vice President of FIP, and welcome to this episode of Coffee with FIP, podcast-style mini-series designed to provide pharmacy professionals around the world with a dynamic platform for informal, evidence-based, and CPD-aligned discussions on key and timely topics in pharmacy that reflect FIP's strategic priorities and programs. Please note that the views and opinions expressed in this episode do not necessarily represent FIP's official position on the topic, unless explicitly stated. The episode is planned around the theme Securing Supply, Addressing Global Medicines Shortages. And the International Pharmaceutical Federation continues to advocate for sustainable, equitable solutions through policy dialogue, data-driven approaches, and global collaboration, aligned with the FIP Development Goal 18, access to medicines, devices, and services. Medicine shortages vary from structural shortages due to, for example, funding causes to acute shortages because of interruptions in the supply chain. We will be discussing different aspects in this podcast. And with me today are Aris Prins, Chairman of the Royal Dutch Pharmacists Association, KNMP, and Shem Moodley, pharmacist from the Pharmaceutical Society of South Africa, the PSSA, and Independent Community Pharmacy Association, ICPA. Hello, Aris and Shem. Great to have you on the podcast. And please, could you introduce yourself shortly? Aris, can I start with you?
Yes, thank you very much, Rob. As mentioned, my name is Aris Prins. I'm the president of the Royal Dutch Pharmacists Association. I am still president, but that will only be until the 12th of December of this year. Then I would have ended my 2 terms of 3 years. But I've always worked very pleasantly and always with great regards to my colleagues with FIP. And I'm glad to be taking part in this podcast.
Great, welcome. And Shem, please.
It's great to be here in this podcast, Rob. And I am part of the national executive of the Pharmaceutical Society, as you indicated, and the Independent Community Pharmacy Association. I sit on the board of directors. I also am part of the FIP Community Pharmacy section as an executive member. And I sit on the regulator in South Africa, in the South African Pharmacy Council, as the head of practice. So that's my role, and I'm an owner, and my day job is an independent community pharmacist.
Great, wonderful. It's great to have you two on the podcast. We really have experts on the field. So I'm looking forward to the discussion we're going to have on the topic, which today, of course, we'll be discussing several aspects of medicine shortages and which affect pharmacists worldwide. So first, let me start by asking about the impact on practice and patients. What are the real-world impacts of medicine shortages on patient care and treatment outcome? First, Shem, could I ask you?
Yes, sure. I think there are several implications for patients, both from a treatment point of view and from an outcome point of view. And it really depends on where this patient is presenting and what we're short of. If you think about a patient that's entering a hospital and requires a procedure, and in the event of there being drug shortages in a theater setting, for example, this could result in a delayed or cancellation of a really important procedure. It could be someone that's requiring chemotherapy, for example, and if there's drug shortages there, you can well understand what the implications could be. From a practice point of view, the first choice medication is probably always the best because it is designed to work best for the patient. But as soon as that's not available and you start to interfere with the patient's treatment protocol, and it forces us to use alternative treatments, which may be less effective, it may have more side effect, it may require different administration, for example, switching from an oral to an intravenous. And this could really lead to compromising outcomes. And you're talking about in a HIV space, if you're talking about patients not receiving their ART drugs, there could be mutation and resistant that comes into the equation. The issue of morbidity and mortality is obviously an important issue when we talk about patient care and critical shortages of medicines. And certainly if there are shortage of antibiotics, electrolyte solutions, cancer drugs, this could really impact directly on both the disease complications, prolonged hospital stay, and even result in some deaths of patients. Now, when you switch a patient from a molecule that they're used to something else, it could lead to quite a few medication errors in terms of route of administration, and just increasing the risk in terms of how the patient perceives their new drug, and might even be taking this drug together with the old drug because they didn't realize that there was actually a switch of medication and because of the drug shortage issue. The big problem we have is reduction in medication adherence with patients. And what they tend to do, if you're switching and you have the discussion with them, they prefer to stay on their original. They will come back and say to you, well, I'll wait a few more weeks and see as soon as you get the new drug or the replacement, can you send it to me? But in the interim, they might reduce their dose, take drugs on an alternate day, half their medication for the day, and you can well understand how this will impact on their clinical outcomes and reduces that, creates the possibility of hospitalization. I think one thing that we mustn't forget about is the emotional implication on both the patient and their family when there's drug shortages, and it leads to severe anxiety in the system and almost a distrust of the healthcare professional and the healthcare system itself. When we switch over drugs from one to the other, remember when you gave the original drug, it was probably the best drug at the cost-effective price for that patient. It might now be substituting a drug that might be of a higher cost, and this could have cost implications. The other big problem, I think, at a broader picture is that you create almost an opening for counterfeit medicines, because as soon as there's drug shortages in a country, people that produce these counterfeit medicines find that gap, and then they start to put it online. The patient might say, well, I couldn't get it at my local pharmacy, but I think I would get it at online. And this could be, you have huge implications on their healthcare. So I think overall medicine shortages really compromises patient safety. It leads to inferior treatment outcomes, and it places immense individual and healthcare systems burden.
Well, Sham, thank you so much for really showing how broad this topic is. It has so many implications, and I'm glad this topic was chosen for this podcast. And as you say, it has the patient consequences are the worst. But and pharmacists are doing everything worldwide to limit these effects. Perhaps, Iris, you could talk a bit about that, the roles of the pharmacists that have there and the impact that this has on them. For instance, what ethical dilemmas arise when these pharmacists have to decide on how to allocate scarce medicine, or if there is no medicine available, or you have to change subjects. But please, Iris.
Yeah, thank you very much, Robert. Thank you very much, Sam, for your elaborate medicine mention that you said about drug shortages. Just to give you some numbers as well from the Netherlands about how big the problem is, because we call it in a Dutch phrase, we call it there's sand in the engine, and you don't want any sand in your engine when you're running. So you want the engine to run smooth, and shortages cause not so smooth running of the engine. And what we've seen in 2024 is that 4.5 million people in the Netherlands were confronted with a medication shortage. And just to give you an example, we have 18 million people in the Netherlands, and 11 million of them are taking medication. So almost half of the patients were confronted with a medication shortage. And that does something to the people, as Sam mentioned, but it also does something to the pharmacy staff. And we've asked, and we've figured out that in the Netherlands, 2,000 full-time equivalent pharmacy staff is used to manage or mitigate shortages. That's one per pharmacy. And that means one person per pharmacy that cannot give therapeutic advice, talk about therapeutical adherence. So really one person is only busy with getting medication to patients. From a cost point of view, What we also see in the Netherlands, just the workforce shortage, just the staff only, is a shortage of 220 million euros in a year that is lost on searching for medication. And then we're not only talking about medication costs, which is extra, because we can import medication from other countries, but there's a reason why medication is available in another country and not in the Netherlands. So a lot of shortages that we are having in the Netherlands are economical shortages. So that means that we pay less for medication than other countries. And then so manufacturers, as it is in the way the market works, will dispense medication to another country before they will dispense it to the Netherlands. And if we get medication, we only get the allocated medication that they think is required for the number of patients. So really just in time delivery. Coming to ethical dilemmas that we faced was last year were two big shortages in the Netherlands. Speaking about ethical dilemmas as well, that was one with the amoxicillin suspension shortage, which also led to a shortage of the tablets and the oral dispersible tablets. And we were really close to a code black in the Netherlands. And this is something that you really don't want to have. You don't want to send people away with no medication. And with antibiotics for children, it was a very desperate time where we discussed with doctors, we discussed with our colleagues in the hospital, discussed with the government, how can we make sure that we do have some antibiotic medication for basically for patients. And we did send people away that were adults that had swallowing problems because we wanted to save that medication for the children. The other one, and to be honest, it is still not solved in the Netherlands at the moment, and I'm a bit ashamed actually to say that, even though pharmacists are not the cause of shortages, but we are faced with them, is salbutamol inhaler. We still don't have a salbutamol inhaler in the Dutch market at the moment available. That's a shortage that started in 2024, in January 2004. And patients literally themselves had to go to other countries to collect it. And we were forced to import medication, salbutamol inhalers from another country, and we still do. And that is really facing with big dilemmas at the moment for patients, for ethical dilemmas. Are we able to give people something else, or are we basically leaving them breathless, which is very difficult for pharmacists at the moment?
Well, thank you very much, Iris, for setting the scene even larger and pointing at the things that pharmacists can do. It is almost an overwhelming problem, isn't it? I mean, that's what I hear. There's a lot of, it causes a lot of emotion, it causes ethical things, but it's overwhelming. The problem in overwhelming situations is that you sometimes feel so overwhelmed that, is there anything we can do about this? Is there anything? And I would like to also focus not just on what there is at this point, but what are the possibilities, what are the strategies and solutions? So I would like to ask first a question on, we as FIP are organizing this podcast because we think it's an important subject and we hope to help our members. But please, can you mention something that you see FIP is doing in this to help pharmacists and ultimately the patients? Shan, would you like to?
Sure. Yeah, I think what Aris has discussed is really critical to the amount of data that is provided from a Netherlands point of view. So I think the first issue for FIP and for many countries is to try and understand the problem, accumulate the data so that we can make good decisions. So from a FIP point of view, there are several initiatives that we've put together. The first being the fact that we work very collaboratively over a collaboration with, for example, the WHO. We always producing documentation, sitting with them in their executive board meetings, and also at the World Health Assembly, and indicating to them what the pharmacist's role is and what the implications are for drug shortages internationally. The other issue is that because we are sitting with about 153 countries in the portfolio of FIP, we're able to source best practice models across the world and share it across all of the sectors. So there's that very valuable information that sits on the FIP website, for example, and could be easily accessible. And the other big issue is to ensure that we have a sustainable pharmaceutical workforce. The educational capacity is up to date so that we can produce a resilient supply chain and ensure that medicines are always available. And this collaboration is done together with the WHO, UNESCO, for example, and other broad bodies. So those are the big issues that we're dealing with from a worldwide point of view. But more practically, there are some really good guidelines that FIP has produced, starting with the statement of policy on medicine shortages that really provide some key recommendations for countries, stakeholders globally, and pharmacists on the ground. The first being the fact that, we really need to establish a public profile on this issue of drug shortages and get communities to understand it. And the only way to do that is to provide that necessary information on drug shortages across your own country and across the world, so that that information becomes accessible and available. And then to create a critical list of drugs within our own countries and extend this beyond, so that when there is shortages, we could share that across many nations and try to find solutions jointly in this model that we've designed in terms of collaborative approach with different countries. The other issue is that FIP does really well is to try to look at risk mitigation profiling, allowing for us to create buffer stock, for example, having contingency plans. And these are all in design models that FIP provides. And all of this can be found in some of our webcasts, some of our policy documents, and it could be used worldwide. Then the other thing that we focus on is trying to have a sustainable resilient supply chain model, and a lot of work is being done around supply chain and ensuring that there's no drug shortages, and some of that you'd find on the FIP website. Two other big issues maybe I must mention is that the regional forums FIP utilizes a lot of the continental work, for example, in the African continent, the Americas, the Southeast Asian region, to address specific regional issues. So regional challenges, we try and highlight that and find solutions, so you can get some guideline documents from there. And then there are some initiatives with the Medicine 2 campaign that we just started 2 years ago, and a lot of work is being done on ensuring that where there's disasters, where there's natural disasters, war disasters, or any type of disasters, that pharmacists within that country and outside its borders are ready to assist where there's medicine shortages. And that comes through some of our humanitarian work through humanitarian RX program. The last one is the empowerment of pharmacists, expanding the scope of their practice. And FIP has been hammering that with governments and policymakers to ensure that pharmacists work to their full scope of practice in terms of ensuring that medicines are always available, and the key role that we play in that environment.
Yeah, so you're making it so clear. It is a global problem, yet you cannot have a global solution. It digs down at regional levels, as you mentioned. It digs down to national levels, what you're going to, and then it goes to individual pharmacists. And I think our audience are people from all these different stages. Most of them will probably be in practice or in research around it, or in education around it. So it's very interesting to see. And I think if I then focus it a bit from the global efforts, regional efforts, to more the country level efforts, I believe, I know the KNMP just won an FIP award because on their approach for how to address medicine shortages. So Iris, please could you tell me something about the national level in the Netherlands, what you've been doing there to help pharmacists and the supply chain?
Absolutely, Robin. And even though it's a podcast, so you couldn't see me nod at everything Sam said, I was nodding because I absolutely agree with everything that's been said. I want to add with that, just if I might, Rob, with what FIP also does is putting forward, I think especially with World Pharmacist Day, is think health, think pharmacist, and showing everyone in the world that we are part of a solution and that you should go to your pharmacist if you're having difficulties with your medication, whether it's if it's available or not. I think Sham made a very good comment about the illegal side of medication as well. We still need to tell everyone that if you think about health, think about your pharmacist, about availability of medication, think about your pharmacist, also with guidelines, with new medication that is available when your medication is not available. And that is specifically something that we've mentioned in the Netherlands. We did win a prize on our campaign Op is geen optie. And what we did with that is to show people the work that's been put into by pharmacists, by their staff, to get the medication to the patient, whether it's calling to other colleagues, calling to other countries, to wholesalers, and even manufacturing of our own medication when there's an unavailability. And what we did is we've showed that in several media channels. So we've used online, we've used YouTube, we didn't use television, we did use radio. And what we saw was more of an acceptance from the people that are in our pharmacies, what the hard work that's been put into by pharmacists to actually get medication. So it was also sort of an educational way of telling people that we are there, we're here to help you, and we're not part of the problem, we are part of the solution, but that does take time, that does take effort, and really showing the audience what we are doing at the moment. And we noticed from our colleagues that a lot of people now come into the pharmacy and say, oh, thank you very much that you are there and you're working so hard to get my medication. Whether it used to be that the trust of patients in the pharmacy used to be a bit lower because they thought they're the reason I'm not getting my medication. That's now turned around. Patients are saying, oh, thank you very much that you are there. Even though my medication isn't available, I know you are there to help me, which is basically the point of our campaign. And we're very proud of that. And we're still building forward on that trust to tell people what we are doing in the moment.
Yes, well, this is a great example because it does show, it links that big problem to what is everybody doing? What can you do in practice? What is what can pharmacists do? And you're not by yourselves. It is a bigger problem. So you have to collaborate. But showing highlights, as Sham mentioned at the beginning of the podcast, look at good practices, see what's happening and showcase them. Not to showcase them just to be out there, but really to show that you have impact, that there is impact, and it is about patients and in getting patients their medication, and that we're doing our utmost best, and that we can really play a role there. So we are coming a bit towards the end of our podcast now. So what I would really like to do is now I'd like to focus on a call to action. So Sham, could you elaborate slightly on what can individual pharmacists, and of course in collaboration with national associations, do to contribute to more resilient medicine supply systems?
Sure, Rob. I think that's a really important question, and you can see some of the work being done already. That Aris has explained that there's nothing too small that will not contribute to the bigger picture. So everything counts. So the first thing is to understand that we have this huge advocacy role, whether you inside a pharmacy, community pharmacy, from a face-to-face with a patient, talking about the fact that there might be drug shortages and how do we counter that with the patient and educate them that there might be alternatives, and the pharmacist has a role to play in providing you with that alternative. So educating the community is one of the big areas. The second is, from a organization point of view, is to ensure that we have a seat at the table when the discussion of medicine shortages are taking place. And in South Africa, for example, one of the things that we learned, I suppose it took the big issue of the pandemic to have these learning experiences, was that we needed to be ready. And the way we did that was actually it was a ministerial task team that was set up by the Minister of Health, and he created this ministerial task team from then that sits 3 to 4 times a year with a huge involvement of many pharmacists across the supply chain, from the manufacturer to the API procurers, to the supply chain management people, to the pharmacists with the patient on the ground, the pharmacists in the hospital, including some of the strategists that look at policy around bringing medicine into the country. So that team of strategic people sit and look at, one, what are the possible complications that might occur in the event of drug shortages? How do we mitigate that and put the risk strategy together? So the one thing that associations need to do is to make sure that you're part of that risk strategy and make sure that you are counted in when they're trying to work out what it is, because you are the one at the front end of it. And then to find alternatives and have a list of drugs that might go out of stock, have a list that have the alternatives on hand so that this can be easily distributed in the event of some very important drug being out of stock. There's an alternative list that circulates within a country, within the association. And this is some of the work that maybe association can do. And then to engage in what I call a rapid response team in the event of many drug shortages, is to identify, get together in this rapid response team and to provide the necessary solutions. And I think we did this really well during COVID, and we should extend that program and make sure that we continue to do that.
Great. Thank you so much again. It again stresses the importance of the individuals, the organizations, and the global organizations to work together and learn from each other. There is an impact that you can make as an individual, as a member organization, as a global organization too. So having said that, again, if you could make one recommendation to prevent future shortages or to deal with future shortages, what would it be, Aris? A big question, but here it is.
Thank you very much for that, Rob. Well, I was just going to say it all starts very small. I don't think we're going to live in a world without shortages. I think it's inevitable that you're going to get shortages. But if you're listening to this podcast and you're in your own practice or you're in a hospital, the first thing you can do is call your GPs, call your medical specialists, call your prescribers that are nearest to you, call your colleagues that are nearest to you, and have a meeting with each other to say, how are we mitigating shortages amongst ourselves? What are we doing to get the story straight? What we don't need with shortages is that we have 50 different stories about what is a shortage, what is the cause of it, what's the definition of it. When there's a crisis, when there's a shortage, you are going to look at the people that are near to you. So make sure they are near and make sure you are there as a reliable source of information, whether it's in practice or in an organization. That's, I think, what you need to do, because we're not going to live in a world without shortages, I'm afraid.
Well, thank you, Aris. On the one hand, not a very good perspective, but I think a true perspective. And it really has been a great pleasure having you both on the podcast, because I think it gave great insights, and I do hope it inspires pharmacists, or at least give them the courage to know you're not by yourself, and there are things you can do, and you can do it in a larger community, and reach out to each other, work. Don't get too desperate. It is a huge problem. It's a pity we have to have a podcast on the subject, yet this is life. And I do hope that this podcast helps the individual pharmacist, any pharmacist listening to this podcast, to, well, carry on doing the great job that they are doing at this point in trying to mitigate the effects of medicine shortages. So having said this, thank you again, Sham and Aris, for your valuable contributions.
You're welcome.
And thank you, listeners, thank you very much for listening to this Coffee with FIP episode. And please check out the FIP website for more resources and episodes.